Hi, good day. This is Adil Sharifat, and I am kind of excited today because this will be my first video with my advanced coping therapy course. So I have videos on basic coping therapy course. So if you feel that you need information basic information about coping therapy course, you can check the series on my social media handles, or rather just go straight to my YouTube channel. I have a playlist for it. So that is that. So here is my first video about the advanced coping therapy course. You're welcome if you're here. So, like I said earlier, my name is Adil Sharifat, and my brand name is Shadebis Help. Sometimes I had help, sometimes I don't. So either you see Shadebis or you see Shadebis Help. So in this video, I'm going to be talking about essential considerations. So, excuse my handwriting. It's not very beautiful. Alright, so I'm going to be talking about the essential consideration before pursuing a career in coping therapy. So just like if you are going to go through this advanced course in coping therapy, that means you are ready to either pursue a career around it, or you just are interested in helping people around you, healing them, and not making a career out of it. So anyways, I would like to talk about the things that you need to consider. So if you are here, I take it that you want this therapy as a career. So the first thing that I will talk about is to cultivate the right mindset. So, just like mindset is everything. Everything and anything you want to do, you need the right mindset. With the right mindset, then you are sure of, say, 20% success. Right. So that's why mindset is everything. Now, for coping therapy, if you want to become a coping therapist, first of all, you need the right mindset. You need the right mindset because coping therapy, just like is an evolving therapy, and there are still so many negative information around it because back then it is the northerners that you see that practice it, and when you see it, you would not even want to have anything to do with it. So those gone are those days. Now coping therapy has been redefined into a modern therapy, so much that in other countries they practice it in, just like a standard university have a medical course. That is how coping therapy is practiced. It is even a standard course in universities outside the country. So never mind what you see or what you have seen or what you have heard about coping therapy. From now, you have to change your mindset about it. The coping therapy is not just a just anyhow course or just a local therapy that you see around done by some malams. Although respects to them, but there are still some things they do not put into consideration. So I am telling you that as a coping therapist, you are a standard professional. Yes, you're a standard professional, and that is only if you have gone through the advanced coping therapy course. So your mindset has to be right. Aside from that, now let's talk about your clients. You also have to be able to take care of the mindset of your clients, because just like you have seen negative information, they also have lots of negative information. So how then do you achieve this? The only way to achieve this is to go through the advanced coping therapy course from the beginning to the end and take the information really seriously, because you are going to be getting, because this is more or less like a new niche, and you are going to be getting lots of negative comments about the therapy because of the misinformation out there. So let me not to take too much time on this point. Let me move to the next point. The next point I would like to talk about is how to overcome initial discomfort. As a coping therapist, first of all, know this. When you perform copying on a client or a patient, you are helping the patient. Yes, we have types of cupping. We have wet cupping, we have dry cupping. When it is dry cupping, that's more or less like a massage cupping therapy. There is no issue. It's just a little suction and then you move it around. But when it comes to dry cupping, wet cupping, some newbies, new hajam, new cupping therapists, they feel so uncomfortable because they feel, how would I be cutting my fellow human being with a blade? And for whatever reason, they don't feel comfortable with it. They do not feel comfortable with it because they feel they are making that person go through pain. But you have to educate your mind. If you're going to be a cupping therapist, you have to educate your mind about the fact that you are doing them a lot of favor. Alright, so do not put your mind at that initial discomfort. Alright, just try to tell yourself that you're doing them lots of favor, and also to manage the discomfort of your clients before it even starts. You have to let them understand step by step what they would go through during the process. Let them understand that at the point of bleeding, they might go through a little discomfort, but if they are able to go through with the pain, then their ailment or whatever reason they are coping for, they will definitely be healed. So the initial discomforts can come with either a coping therapist or the client. So you have to know how to take care of that. All right. So moving to the next point, to collaborate. The next point says collaborate with medical practitioners. I am a natural therapist. Yes, my beliefs are in the alternative ways of taking care of the health. But if you have stumbled on my video, I always talk about the fact that even though I talk against pharmaceutical drugs, so some people get it wrong. I do not talk against pharmaceutical drugs. I talk against the abuse of pharmaceutical drugs. There are two different things. We tend to abuse it so much in this part of the world, which is causing a lot of health implication, and that is part of the reason why people like myself have decided to create a brand around it, because so many people are getting they are getting so sick because of this. And the worst part of it is that it is a long-term effect. That's a long-term effect. In fact, the effect might not come until old age, and those are the reasons why we want to sanitize people to reduce the abuse of their pharmaceutical drugs. I use drugs too. I use drugs, yes, but the difference is I have a headache. I kind of look for the cause. What might be the cause? Take a rest. If I've been stressing, I rest. If I've not been taking enough water, I hydrate. I do other things. I relax. I take herbs. Not the concocted herbs you see out there. Just maybe if it's any of the spice, clove I see around, I take it and wait and endure that pain for a while and see if it will go away. Then if it does not go away, that is when you can proceed to say, okay, what is triggering this headache might be maybe you are developing a fever, because that is, or malaria, that's very constant around this part of the world. Then you can now go ahead to say, to do a medical test and see the exact problem and then go for drugs. That is what we are saying. That is what I represent. I do not discourage people from going to the doctor or taking medications, but not headache, Panadol, chest pain, paracetamol, eye pain, like stronger analgesic words. That is killing our body system. So, in order not to digress too much, we collaborate with medical practitioners. As a copy therapist, you have to collaborate with medical practitioners, not because your therapy do not work. No, You do this because at some point, for instance, if you have gone through my advanced course in corporate therapy course, you would there's a particular chapter that has to do with consultation of your clients. Yes, you learn a little about consultation, you learn the psychological way of consulting with your client. When your patient comes in, you liaise with them and you try to make them comfortable with you. You try to make them be your friend, and so that they can comfortably tell you the exact thing that is wrong with them. Right? So if you have been able to do this, you still cannot trust that information 100% because we deal with blood. Corporate therapy deal majorly with blood, especially the wet cupping. So we want to be 100, in fact 101% careful of who you talk to. So some people have so many underlying diseases that they know of and they will not talk to you about it, while some do not even know that they have it. So that is why whenever a client comes to you, and then you can visibly look at the client and notice there's a serious issue, then you can send the client for a test. So instead of the process of sending the client to a test, some clients actually get discouraged in all of that long process. So when you have a medical practitioner by your side, then you can easily just do the tests by yourself within your brand. Alright, so that is the essence of having a medical practitioner. Shadebis Complementary Healthcare has one too. So for those of you going on and on with the notion of we are talking against medical line, no we are not, we work together. Alright, so that's for that point. Then another point is that you should never advise clients to stop medication. Never. There's a reason why I use this word never, because you can never ever do it. Never advise clients to stop medication. Yes, you as a corporate therapist, you understand that it is okay for them to stop medication. All right, you understand that your therapy works well, works perfectly. But do they know? No, they don't. But when you are dealing with this part of the world where there is 120% belief on the medical world and the pharmaceutical world, you have to tread carefully. There is what we call the psychological impact. There's some people are not really sick. They just feel they are sick, they go to the doctor, they are given medication. Yes, they will use that medication and they will be fine. Not because the medication exactly worked, or not because they have any issue at all. Sometimes they don't have any issue, but because of the 100% trust they have in the medication they are using and the doctor they are going to meet. So that is the reason why they feel, oh yes, it has worked. So there are plenty of cases like that, lots of cases like that. When a patient have 100% on the medication they are using, you dare not tell them to stop, because if they stop, and because of their present mentality, and even if you do the corporate therapy, they might not feel relieved. Not because their body system is not relieved. Their body system would have been relieved. Another point is that you should never put an individual with an unstable health condition through the therapy. Yes, as much as corporate therapy can be the best, you should not put an individual with an unstable medical condition, health condition through the therapy. What do we mean by unstable health condition? It means somebody that is which example can I give? Let's say somebody that has a very serious stomach ache, a very serious headache. I mean, as serious as rolling on the floor. Somebody that is into pains that they are not in control of anymore. You don't put people like that under through the therapy. Or let me just use an extreme example here. If a patient that has fainted, let's say, okay, somebody fainted now, and they know you to be a coping therapist, then they are rushing the person to you so that you can revive them with coping therapy. No, don't you ever try that. Don't try that, because anyone with an unstable condition needs to be stable first before you can put them through the therapy. And the reason is simple. With the negative information going around the therapy, you don't want to do that, because because coping therapy is a natural therapy, and the way natural therapy works is different from the way drug works. The drug is chemicalized, all right. What drug do is that they go and they go into your body system and kind of like switch off the sensor or the cell that is meant to pick that pain to the brain. It is when the cell is able to pick the pain to the brain, that is when we start feeling it. So the drug kind of intercepts that sensor, that cell that is supposed to do that work, so the pain will stop. Like you feel the pain stop, but the problem will still remain. That is how pharmaceutical drug works. Like coping therapy, what it does is that it works gradually. It goes into the root cause and then take care of it from the root cause. So it does not intercept with the pain at all. It goes to the root cause and heal that person. And this might take months. This might take weeks. Although coping therapy is known to be very effective when it comes to pain management. So therefore, a patient that has come to you believing in your therapy would want a fast relief. All right. So that is why we do not do that. Coping therapy is a natural therapy. It goes to the root and take care of it from the root. So with this point, I have come to the end of this particular video. Thank you so much for staying till the end. Thank you and have a blessed day.